We are very happy to have this conversation with Dr. Emmanuel Hosein, Chairman of Disabled Person International, the Trinidad and Tobago chapter. We also have the President of CODO, and I think this might be the only time we call her Jacqueline, but Jacqui Leotaud. And we also have the President of PAVI, Mr. Bhawani Persad. So we say thank you very much for joining us. And Bhawani, we'll start with you, thanks. And we're still saying happy birthday, I guess, to PAVI, but 25 years on. You know, there's a calypso, 25 years have gone, how you feel? What can you tell us about those 25 years on PAVI?
Well, there have been many accomplishments nationally, regionally, and internationally. One of which is that we were able to advocate for and got the voting rights for persons who are blind and visually impaired. We have had programs for the young, for the not so young, for the elderly. We have lobbied with several agencies. We are a member of the Caribbean Council for the Blind. The Caribbean Council for the Blind. We are a member of the Consortium of Disability Organizations, and we are associate member of the Commonwealth Disabled People's Forum. So we are making our presence felt both at the national, regional, and international level.
Thank you very much. And Jacqui, I'll go to you, please. The importance of having a consortium at a time like this when there's so many changes, so many disruptions. Talk to me about how significant it is to be able to be operating with a unified sort of voice.
Very difficult. Simply because our whole secretariat is not in operation. It's only persons are there only part-time. And so we have tried to reach out to our members. We did help them initially at the beginning of the lockdown to help them with some, hampers and stuff. But to get coordinated efforts going has been difficult.
Is that something that you're experiencing as well, Dr. Hosein?
Well, in DPI, unlike CODO, which is a conglomeration of associations, we are a conglomeration of individual disabled persons, all disabilities, whether hearing, physical, intellectual, sight. Once you are disabled, you are coming as an individual member of DPI. We functioning fine. Of course, with the COVID restrictions, we've had a little constraint on our meetings, but we functioning well.
Okay, now I want to ask you the same question, please, Bhawani. How has functioning been taking place during this period of the pandemic? Because one of the things that we would have seen is that in terms of coughing and sneezing etiquette, people are talking about sneezing into the crook of your elbow. But at the same time, there was a question, okay, well, if someone is helping someone who is visually impaired or blind to walk, that is the area that that person normally holds. So what are some of the other issues or challenges or situations that you're facing at this point in time?
Well, thankfully, for the COVID period, thus far, most of the people have been home, most of the blind and visually impaired persons. So street navigation has not been as difficult. Now, we understand this whole question of social distancing, which, if COVID continues for any length of time, will create problems. I had one experience traveling to town one day during this COVID season, and what happened is that when I wanted to cross the road, the person, I allowed them to hold my hand rather than me look for their elbow, so that you could avoid that sneezing scenario, which says sneeze into the cup of your elbow, etc. But basically, most persons have been home. If you went out as a blind person, you went out with somebody who you trusted, who you know, like a family member, a spouse, and that kind of scenario. But for the most part, people have adhered to the COVID restrictions. But going forward, it will really pose some challenges, especially for those who travel independently.
If you had the line or the air of someone in policy, and I'll ask each of you, what is the single most important thing or who's the person you speak to, and what would you be speaking about? Bhawani, I'll start with you, thanks.
I think consultation with the community at large, whether it's individually or collectively, to me will help to mitigate any kind of major and significant problems.
All right. Ask Jacqui, please.
I think consultation with all parties, whether individually or collectively, by the relevant authorities, the Ministry of Health or any other agency who is so tasked with the COVID-19 management, will help us to understand and they to understand too what are the challenges facing persons with disabilities in our community.
Okay, and I'll ask you the same question, please, Ms. Jacqui.
I think that all of the issues are cross ministries. So to identify one person you need to speak to, it's difficult. I mean, you know, because for Bhawani to travel independently and not have issues, it's one ministry you need to put things in place, or should have put things in place. And so, you know, it really depends on which fight you're fighting at that particular time. The Ministry of Health should be forefront in facilitating as many people as they can and ensuring that persons with disabilities can have access to all the health that is needed. So they're a big part of it. The Ministry of Education, because there's no school going on right now, all of the students have the same issues as the kids in the regular system. And so they need to ensure that the students who have special needs have all the hardware and software and are able to access their education as well. I'm not saying they weren't doing it, because they have been, but these are the people that you would need to ensure that are delivering services for all of our community.
Okay, thank you so much. And Dr. Hosein?
Well, I want to just disagree a little bit with
Jacqui.
Jacqui there, that the Ministry of Health should be the lead. Internationally, the disabled movement believes that it is the Ministry of Social Development or Social Welfare that should be the lead in disability issues. However, because it's a health crisis we're facing, the Ministry of Health has been on the ball, I would say, in terms of the public health requirements for dealing with what is an extremely or highly contagious disease and very dangerous. The problem for the disabled is that, well, let me put it another way. The disabled do have a bit of an advantage in that they are accustomed to not being out there. The problem is, however, that they require people to come and make close contact with them in order to provide what assistance they may need. And that provides an opportunity for the spread of the disease. And I think the Ministry of Health maybe should have devoted a bit of extra time to dealing with the extra risks that disabled people may face. In addition, the disabled have more comorbidities than the average citizen, whether elderly or otherwise. And I mean, speaking for myself, while I'm a pensioner and I only come out of the office to, you know, keep myself active, I literally shut down my practice for months because I anticipated people with the disease might come to me. Then, of course, we seem not to be having spread in Trinidad. So then I came back out for a little bit, and then the spread became community-based, and I shut down my office again. And I'm now out in the last 2 weeks, mostly because we're not seeing the kind of massive spread that one could have anticipated. So the disease seemed to be cooling down a bit. But I'm just speaking here how it has affected me as a professional working. The disabled at home, those who are at home, as I say, have the risk of people coming in and out. And those who may need to be out have problems with transportation. You know, you normally have a problem, but with restrictions on transportation, that would have been multiplied.
I just want to add, DK, that in terms of persons coming in and out, this is why our programs at PAVI, the orientation and mobility, we have had to suspend that because you cannot go into people's homes and such
yes.
like. So we hope that this COVID pandemic will leave us sooner than later, and we can continue to provide services to those who need it. But as it stands now, everything is at a kind of standstill.
And no, we're not taking a standstill, but we're taking a little break, and we're coming back on this conversation. Stay with us. Welcome back. We are speaking with Bhawani Persad, Jacqui Leotaud, and Dr. Gabriel Hosein, or Dr. Emmanuel Hosein, rather. And Dr. Hosein, you started on it in the sense that you spoke about the experience of people with disabilities past the borders of Trinidad and Tobago. And I want to know what kind of interaction you've had with people outside of Trinidad and Tobago, and what are they saying? Are they saying things that are similar to your experience, or?
I can't say I've been in touch with disabled persons outside of Trinidad and Tobago to say there's any unique experience or different experience that may have come to me in that way. But one reads the international literature and what's available on the news. And I think the problems are going to be the same wherever you are. The disabled do not necessarily benefit from as much as you might think from the level of development in an individual country. People in developed countries who are disabled have, if not quite as much, but almost as much difficulties as somebody in a less developed country. So that I don't think the experience is going to be that much different, really.
No, and it's one of the things, because we were just at looking at Spotlight and how some of the urban revitalization is going to be happening in Port of Spain. But the pandemic, one thing it has really kind of shown is that there's so many levels and levels of inequity. And I haven't passed by PAVI's office in a little while, but what I found very interesting is that even though there was a gradient to get from the pavement to the road, there was still a gap. So like about 3 inches. So if you're pushing a wheelchair or if you need to step up, that's still something that wasn't necessarily focused or as much attention was paid to. What are some of the other things that we need to pay some attention to? I'll ask you, Dr. Hosein, we'll ask Ms. Leotaud, we'll ask Bhawani.
The whole question of accessibility and ease of movement for the disabled persons, whether sight impaired or physically challenged, is one that is very bad in Trinidad, and I don't see anyone addressing the problem from a governmental perspective. We've tried to have meetings with the Ministry of Planning, and we are waiting. We have met with mayors, all the local government leaders, many of the ministry, transportation, education, social welfare, etc. And the whole accessibility thing is not getting the kind of attention it needs to. And we are way behind the curve. The fact that there's now an epidemic of this kind just exacerbates those problems.
And what's your thoughts on this, Jacqui?
You had mentioned the development of Port of Spain area, which we are looking at. I think it's important to ensure that all the pavements are accessible, all the lights, persons who are blind, persons who are deaf, and wheelchair users can actually be able to cross independently at crossings. And the transport in and around Port of Spain needs to be addressed so persons with disabilities can access the transport. So Dr. Hosein is right. It's all about accessibility. The buildings need to be accessible, the pavements. You can't have pretty trees lining the pavements, or else somebody like Bhawani walk right into them. So, it needs to be thought of and thought about and planned with persons with disabilities in mind, because we are part of the community as well. It's not like you're catering to some person who's not there. We are part of the community, and you have to make sure that we can access all over the Port of Spain, the new Port of Spain.
And that may be part of the issue, or a big part of the issue. I remember someone telling me that access requires acknowledgement. I remember one time I cleaned a counter, and then somebody said, DK, you sure this counter clean? and the person we have a little height differential. So when I bent down to their level, I was seeing what they saw, and I was like, oh yes, I need to make a pass over this again. But what's your take on this, Bhawani?
Well, as both other contributors have said, accessibility is the major talking point and is the major point, actually. And of course, if they accept and use the universal designs that are international standards, I think it will help us immensely. I'm glad Jacqui raised the issue of trees, because you have those decorated trees along the pavements, and I had the experience with somebody of running into one of those trees. The wire at top was exposed, and that person actually lost 2 feet in the process. You know, so doing one thing is having beauty is one thing, but also studying the convenience and all the inconvenience that it creates for persons who are blind and who otherwise have a disability. I am happy to note that they have started to charge people for parking on the pavement, because I know that has been a problem this time immemorial. So I think that they need to inspect a lot more of this. Also, parking in the wrong places, etc. So persons with disabilities, blind and otherwise, have to use the facilities like anybody else. We are people first, and we must be treated equally.
Well, the actions of your organization are still continuing, I'm sure. And but
yeah.
How do people contact you? And I'm also wondering, we have just over 2 minutes left, but what kind of activities are you working on? Are there fundraising activities? We know Christmas is in the air. This means different things to different people. What is on your agenda? I'll start with you. Thanks, Bhawani.
Let me start with PAVI. We have a curbside pickup Christmas luncheon on Sunday, the 6th of December. We have 3 pickup venues. That is Princess Elizabeth Center in Port of Spain, the RC Church on Harris Promenade in San Fernando, and downstairs PAVI's office at Campus House 32 Eastern Main Road, St. Augustine. There is going to be a Christmas menu. There's going to be desserts, drinks. All you have to do is to book your tickets in advance. You can contact us at 220-1073, or you can visit the PAVI Facebook page for further information. It promises to be a great event. Normally we have a sit-down event and socializing and all of that this year. Of course, keeping with the new norm, we have to do differently. The cost of ticket is just $200, and we urge people to call the office, make your booking before. You can pay by check, you can pay by direct deposit to our bank account, bank number, and you can also pay on the day. We hope that there are enough trustworthy to do that. But if you don't make an order, if you don't make a booking, you might just be left out, because we do not want to oversubscribe, neither do we want to undersubscribe. So the date again is Sunday, December 6th, and it's from 12 noon to 2:30 p.m. in Port of Spain and St. Augustine, 12 noon to 2 p.m. at the San Fernando location, which is the RC Church on Harris Promenade. And we hope that people will support this initiative, because we have some work to do, we have some bills to pay, and we need to continue focusing on empowering blind and visually impaired persons in our community.
Thank you so much. Ms. Jacqui, is there anything on the agenda with regard to CODO? I know you said that meetings have not been happening as such, but is there, what are you looking at?
No, we have nothing specific planned for this season. But I would like to tell our membership, or anybody who needs information, that there's somebody at our office on Mondays from 1 until 5, Monday and Thursday, and they can contact them at the telephone number of 621-1874.
All right, thank you so much. Is there any updates that you'd like to give us, Dr. Hosein?
Just to mention that the city of Port of Spain has an arrangement with the United Nations to get funds to look at the pavements for the disabled in Port of Spain. We had a meeting with the mayor some time ago, and what he told, the requirement is that the money comes through a disabled organization, and he has made arrangements with the blind welfare to receive those funds. I hope he remembers what the requirements are in terms of this new plan to develop Port of Spain, and what the requirements for pavements and accessibility of the disabled are.
All right, and we'll try to do our part to send that reminder home. We want to thank you 3 for being a part of this. And on behalf of the entire newsroom, we want to thank you for joining us this evening. I'm DK Roster. Have a good night.